Tonight continues now. Good evening and thanks for staying with us here at 7:30. While many of us may consider the month of September as the return of school, football, and cooler temperatures, what you might not know is September also marks National Recovery Month. Significant because it means public health leaders are talking about a major step forward to preventing deaths from opioid overdoses. Naloxone, best known as the nasal spray Narcan, now available as an over-the-counter medication. The Food and Drug Administration approved it for sale without a prescription earlier this year. Just one dose of Narcan can reverse an opioid overdose. It's often carried by first responders, available in schools, and even found in special vending machines. Now it can also be purchased at major retailers like CVS and Walmart. A retail price has been suggested to be as low as $45. The Department of Health and Human Services held a demonstration of the life-saving drug this afternoon.
Just like this. So we're going to dispense the Narcan into the nostril.
Naloxone makes it possible for us to save a life. But it takes you, it takes me, it takes us to make it happen.
This weapon fighting overdoses comes as law enforcement is sounding the alarm on just how prevalent opioids like fentanyl are on our streets. Just last week, our Alex Giles had a candid conversation with the Cornelius Police Department, warning us about the dangers fentanyl can pose to anyone. Here's part of Alex's report.
How much do you hear about fentanyl these days?
I would say fentanyl is something that we hear about every day.
Fentanyl, the synthetic opioid that has had a big rise in popularity. Take a look. Data from the National Institute of Drug Abuse shows a sharp increase in the number of overdose deaths across the country, all due to synthetic opioids. The numbers have been rising since 2015 and 2019, an even sharper jump. Captain Jennifer Thompson is with Cornelius Police. For her and other officers, fentanyl has become a fixture in the law enforcement vocabulary.
Well, this is what we believe is fentanyl. Pills laced with fentanyl, or could be 100% fentanyl. We just don't know.
Any idea how much more you're seeing of it, these days than maybe 5 years ago, 10 years ago?
5 years ago, 10 years ago, non-existent. Now it's just a part of what, some of the teenage groups are experimenting with.
Why do you think it's become so popular and so commonplace?
I think it's because of its potency and how strong it is.
Scary, right? That brings us to today. A strong opponent needs a strong weapon to fight it. The CDC says naloxone saved 50,000 lives in 2019. Medical experts say it's safe to use even if someone appears to be overdosing but is not. And that is why obtaining Narcan over the counter could prove to really be a major game changer here in the country's ongoing battle against fentanyl and the anguish the drug can leave behind. WBTV Washington Bureau correspondent Ryan Henson brings us more on how this powerful tool is now becoming more common to the public.
White House officials want as many people as possible to pick up naloxone. It's a medication that can save someone who is overdosing. It's like Narcan in a nasal spray. White House Office of National Drug Control Policy Director Dr. Rahul Gupta spoke at the Department of Health and Human Services on Friday. He focused on the benefits of getting this medicine into more hands.
We often talk about how adolescent overdose poisonings and deaths doubled when we look at between 2019 and 2021. What we often don't talk about is that in 2 out of 3 of those cases, there were bystanders nearby, but naloxone was not.
The Biden administration spent $170 billion in total on drug control funding to help keep more Americans alive. Every 5 minutes, an American dies from an opioid overdose. Now, federal officials are urging folks to buy naloxone, a drug that's sold over the counter that could save a life near you. Dr. Gupta explains how this drug brings overdose victims back to life.
What happens is all these your breathing receptors in your brain and everywhere are blocked by this drug. So you can't breathe. And naloxone, what it does is it goes and replaces that drug on those receptors, and so you wake up.
Naloxone is sold for $45 at pharmacies. But Dr. Gupta says the White House has subsidized 9 million doses if you tell pharmacists that you need but can't afford the medication. The medicine is important because it gives the victim a chance at treatment. the other side of slowing drug addiction.
We also want to make sure, and we're working to expand treatment. So now you see more treatment becoming available than ever before in the history of this country. We're also not only putting harm reduction available to people, but also making sure that people get into recovery, successful recovery.
Reporting in Washington, I'm Ryan Henson.
Ryan, thank you. Important